My name's Janine Kaczynski. I am 31 years old. I live in the San Francisco Bay Area.
My name is Maddie. I am 18 years old and I'm from Illinois.
My name is Jack. I'm 19 and I'm from Cambridge in the UK.
My name is Bricky. I am 20 years old. I am from Pennsylvania and I have been diagnosed with CRPS for 3 years now.
I'm in pain all the time. I'm in pain right now. There's no turning it off.
Pain kept getting worse and worse and worse every day, and it obviously plateaued, but it stayed at an awful level.
When you're in that much pain, it's so hard to stay calm.
I wasn't able to put socks on. Taking a shower, I always had to stick my foot out of the bathtub because it just hurt that bad to get water hit on it.
I'm in pain somewhere between 6 and 8 out of 10 every day. Sometimes it gets to 9 where I'm curling up in a ball on the couch, crying and crying and crying, and there's nothing I can do about it, nothing.
I was 12 years old, hadn't slept in a week because of pain. I went to the ER with my mom, and when my x-ray came back normal, the doctor accused me of drug seeking at 12 years old, and he sent me out of there with no help.
I was then invalidated so many times by different doctors who said that it wasn't real, I needed to get on with my life, and it was such a frustrating time because I was living and struggling, but no one listened.
I lift weights, and people don't understand that just because a chronic pain sufferer is lifting weights or doing some sort of physical exercise doesn't mean they aren't in intense pain.
It's very important that people get the right help and people aren't inconsiderate of people's accessibility and their struggles.
I've lost this piece of myself, this identity of being an athlete.
Certainly it has limited a lot of the things I've been able to do, like learning to drive and doing a lot of normal teenage things.
Before CRPS, I was a very active kid. I was a dancer. I spent every day at the studio, and with CRPS, I didn't walk for a year.
From a personal experience, functional neurological disorder is a big one.
Ehlers-Danlos syndrome, POTS, postural orthostatic tachycardia syndrome, small fiber neuropathy, anxiety, depression.
My favorite way to spread awareness and to hopefully reach the medical community is by advocacy. The internet is an amazing place where we can just put a lot of content out there, such as this video, to educate our peers, to educate our doctors, to educate our psychologists and our psychiatrists about these types of illnesses that they just simply don't know about and sometimes don't want to know about.
It helps just the world of medicine understand these conditions better. Everyone, especially people with invisible illnesses, deserve to feel understood, and spreading awareness just brings light to conditions that are kept in the dark for so long.
Not a single doctor knew about CRPS. They had no clue. I always had to explain what it is, and I just feel like posting more about it on social media will get it out to everyone.
Raising awareness is the only way really that people will ever find out about these conditions. It's so important that people have at least an understanding of the condition and how they can, as an individual, either raise awareness or better help the community raise awareness for these different conditions.
I just have to keep going and have faith that the medical community will eventually catch up and develop either a treatment, better management system, or even a cure for CRPS.
My name is Lucy Rivas. I am 17 years old and I am from Raleigh, North Carolina. 7 years ago, I was diagnosed with CRPS, and I've decided to use my own diagnosis to create Chronically With A Cause. This video is dedicated to all of those who suffer with any invisible illness. Please share this video in order to spread the word about invisible illnesses.